Labor HHS Appropriations Subcommittee had a most remarkable hearing on Down syndrome, which moved us to a new understanding of this disability. DS is a genetic disorder that affects over 300,000 men, women, and children in America. It is the most common chromosomal disorder and the most frequent genetic cause of learning disabilities in children. Each year, approximately 6,000 babies in the United States are born with Down syndrome, a condition resulting from an extra 21st chromosome. 60 years ago, people with DS had a life expectancy of less than 20 years, and most lived their lives in institutions. Today, due to early medical care and being raised in loving homes, these children can expect to live well into their 60s. Last week's hearing was one of the most emotionally charged and inspirational hearings I can recall as a member of this subcommittee. The room was filled with children and adults with DS and their families, including my young constituent, Jose Cisneros. Amidst the tears, laughter, and applause, we heard inspiring stories about the amazing accomplishments of DS teens and young adults in sports, scouting, community activism, and film acting. We learned that they are graduating from high schools, attending colleges, and working at jobs in their communities. And most importantly, we saw how these young Americans are teaching our country about the value of diversity and inclusion, while at the same time increasing the happiness quotients of those lucky enough to be in their very wide circle of friends. We also learned some very surprising and amazing facts about Down syndrome. Researchers told us that individuals with DS are medically very special. On the one hand, they are highly predisposed to autoimmune disorders such as thyroid disease and rheumatoid arthritis. Children with DS are 50 times more likely to develop childhood leukemia, and virtually all adults with DS will develop the brain pathology of Alzheimer's by the age of 40. But they also said that due to a small difference in their genetic makeup, persons with Down syndrome are naturally protected from heart disease, high blood pressure, and most solid tissue cancers. Researchers said studying these unique genetics could help discover ways to prevent or cure diseases such as cancer, autoimmune disorders, and Alzheimer's disease. With such promising potential, one would think the federal government would invest heavily in Down syndrome research. Unfortunately, what we learned was that over the last 2 decades, DS has been one of the least funded genetic conditions at the NIH. This hearing left no doubt about the need for a significant and sustained investment in Down syndrome research. A trans-NIH DS initiative could help not only find answers and cures for DS, but discover its mysteries, which can answer questions about other serious and life-threatening diseases. While the benefits of DS research are unquestionable, it will take time to realize its full potential. In the meantime, we must ensure those living with DS can access and afford high-quality, coordinated health care and the long-term services and support they need to live productive lives in their communities. Medicaid, long-term supports, and Medicaid community-based services give them that opportunity by enabling them to maintain gainful employment and stay in their homes and in their communities. Sadly, across our country, thousands of people with Down syndrome are on very long waiting lists for those services. As lawmakers, we have an obligation to find a bipartisan way to protect and expand Medicaid services so all individuals with DS and other debilitating diseases have access to the lifelong interventions and support they need. The time has come for this country to embrace the gift and potential that Down syndrome brings to our society. The 300,000 plus Americans living with DS today want and deserve the same opportunities available to all of us to live a full life and to reach their true potential. I yield back.